Anemia was the third risk, but I did not see any reported at Regional Medical Center. And in looking at their logs, I found that the highest rate of complication was the nuchal cord, and I didn't know what CAN stood for, and now I know that it stands for cord around the neck, that greater than 50% of our babies had cords around their neck with all the ethnic groups. They were not just specific to our Asian group. In starting this program, my plan with the Robert Wood Johnson Foundation was to obtain funds to start a centering pregnancy program at Regional Medical Center. And it wasn't to be specifically for the Asian groups, but I was focusing on them. And I wanted to define centering pregnancy. It's an innovative intervention that could reach large groups of pregnant women. And in this case, we had these classes, they were really sessions, headed by a nurse practitioner. And it's an improvement program to reduce health disparities, and it's an interdisciplinary model of empowerment that we had our advanced nurse practitioner head at Regional. It's a lucrative program where we could provide an atmosphere for all the moms of all ethnic groups to just share and learn from each other. And like I say, it was led by the expertise of an A&P. And we did this to provide health care with positive outcomes, not only in prenatal care, but we wanted these moms to start really looking at health for their whole families. The program that I set up at Regional, I worked collaboratively with 3 physicians, Dr. Doug Pham, who had mostly Vietnamese patients, Dr. Suresh Nayak. His patients were mostly the Indian women. He had a few Hispanic patients. And Dr. Dale Capulong, all of her patients were Filipino, Caucasian, and she did have some Vietnamese patients. The nurse practitioner met for 1.5 hours each week, and it was not the same group each week. And it was for the purposes that I shared. It's a teaching, learning process for all the women and the A&P answering their questions. This was an added session compared, in congruence with their visits to their private physicians. And as their pregnancy or EDC date came closer, they were visiting the A&P more frequently. I held these sessions at our Pepper Tree C room in our basement floor, and the use of the classroom was free, and we did not charge any of the mothers any cost. I chose to ask for only $5,000 to pay our A&P. I feel like I would rather be giving the money than asking even RWJF for money. And I know it sounds kind of stingy in terms of what I asked for. I could have asked for $10,000, but I thought $5,000 was a good start. And like I say, the classroom did not cost us anything, as long as I scheduled the classroom 3 weeks in advance. For me, this project was to learn more current concepts in prenatal care and just gain a better knowledge in the care of our Asians, and then help reduce health disparities for all peoples. Interestingly enough, towards the end of all my research, I find this chart that shows the disparities in our country between 1989 and 2006. But if we look at 2006, there is very little disparity, and they're marked in red on the chart. For the whites, the disparity is 88% versus our Asians at 84%. There's only a discrepancy of 4%. So I came to the conclusion that there's very little disparity between the Asians and the whites. But what concerned me was looking at our American Indians. It is only 69%, I mean, theirs is low at 69% compared to our 88% of whites. That means that there is almost 20% disparity between these two ethnic groups, and that I would like to see us even do a study with our American Indians. And it seems like that's where the greatest need is. We really, as nurse practitioners, want to reduce disparities among our ethnic groups, but the greatest need that I see here in doing this is our group of American Indians. And I know we have them in Arizona, New Mexico, Alaska. There are other places like Milwaukee, and we need to do further studies there. I thank Robert Wood Johnson Foundation in granting us monies to help reduce health disparities in the United States, and I would like to see us work on reducing the disparity amongst the American Indians. If any of you have questions, you can email me at my USF Dawn email. It's my name, P.D. Ross, at usfca.edu. And the only question for myself after I did this was maybe I should have asked for more monies to pay our nurse practitioner for doing a fine job. Because if this works well this year, we can continue to do it each year. Thank you.